Prior to having hip problems, I was a very active person, all the time, just doing outdoors things in the house, remodels, that sort of thing. Once the pain started coming in, that changed things dramatically. At first, it's based on how active you are. And so you start to kind of decrease your lifestyle accordingly. But I can remember 2019 in the fall is when I noticed something completely different. The pain was relentless. It was constant. Day, night, all the time. You can't even bend over to pick things up. And when you get into your 40s, you become accustomed to bumps, bruises, pains, aches, things like that. I kind of noticed it was odd. I couldn't pull my knee to my chest anymore to stretch, and I could really feel a pretty strong pain in my groin that just wouldn't go away. I couldn't sit in a chair. I had to stand up because standing was more comfortable than sitting. Being a veterinarian, I went after hours so none of the staff would see me take an x-ray of myself. I looked at it and I could tell that my hip didn't look so good. And it took a while to kind of process that, but that's when I made the appointment for my evaluation. Most people don't walk in the door with pre-existing x-rays that they've taken of themselves. And I think they got a kick out of that. But I do remember walking into the orthopedic department and I took one look around, and it was a little daunting your first time. And they take you straight back, they take x-rays, they put you in the exam room. Dr. Heisler came in and just says, well, you need a total hip replacement. Your hip's shot. By the way, your other hip's shot too.
Marcus came into our office complaining of hip pain. He's young, and it's a pretty common complaint that we see. He had very clear severe arthritis. He kind of looked into it himself a little bit, being a veterinarian, and there is some crossover to human medicine. So at the end of the day, I think when people come with knowledge, it's helpful. When we were looking at Marcus originally, we already knew that he had x-ray changes or radiographic findings consistent with arthritis on the other side.
My sockets are turned out just a little bit, so it was kind of getting point loaded on there, and that just made it wear out a third quicker.
He really did try everything short of hip replacement. He got to the point where he really couldn't take it anymore. He thought about it. We talked about all the options. Anterior hip replacement is a great alternative to traditional posterior hip replacement. It is liberating for people. We go between the muscles. We don't actually detach anything. We leave all the primary restraints to hip dislocation in place. I don't like the term less invasive. I like to say muscle sparing.
So the day of surgery, I was actually pretty excited because I knew there was relief around the corner. I had my first hip replacement done November 17th of 2021, and I had my second hip replacement April 22nd of 2024. But on the second hip replacement, I didn't push things near as far. I knew how the surgery was gonna go. I knew how it would change my life, that it wasn't that big a deal.
He knew what he was getting into, he was prepared, and he came the second time, hey, let's go, let's rock and roll.
It's really a pretty easy procedure. You don't really notice the nerve block, and at that point, they roll you back into surgery, and my wife's coming around the corner with a smile on her face.
The hip replacement portion of my practice is very rewarding because you have people come in that are truly suffering for a long period of time, and they get better so quickly, and they get back to work. And when somebody comes into your office, it's 2 weeks, and they walk in and they're not using a cane, crutch, or walker. It's just amazing. It's a blessing to have that opportunity to do for people.
So life after a hip replacement is pretty much back to normal. Dr. Heisler told me that nearly every one of his patients will tell him at the 1-year mark that they forgot they had a hip replacement. I have a standing moving job, so I took 3 weeks off of work. I get on the floor with animals. I was at the point where I couldn't throw my leg over a bicycle seat. My one son rides dirt bikes. I couldn't ride those with him. I can do that. I jump off of things. It functions just like the original hip did. I'm pretty much back to 100%. You don't think twice about doing anything. I just want to take this opportunity to thank Dr. Heisler, start to finish, the surgical staff, all the way through to the physical therapists and occupational therapists before you leave, and the entire staff at Parkview. Everybody did a great job. Thank you.